We will talk today about the pulmonary artery catheter, Swan Ganz. Our learning objectives are understanding the Swan Ganz catheter, identifying clinical indications, recognizing contraindications of using the Swan Ganz, understanding parts of the pulmonary artery catheter, performing nursing responsibilities during catheter insertion, pulmonary artery catheter waveforms and data, providing post-insertion care. What is the Swan Ganz? The pulmonary artery catheter, or Swan Ganz, is a thin catheter equipped with sensors, inserted via an introducer, MAC, or cordis, which is placed through the internal jugular, the subclavian, or the femoral vein. The Swan Ganz aids in measuring the pressure in the chambers of the heart and in the pulmonary artery. It also uses hemodilution techniques to calculate cardiac output, cardiac index, CO/CI, and the systemic vascular resistance, SVR. Indication for PA catheterization. PA catheterization is used in the diagnosis and management of cardiovascular illness, such as pulmonary hypertension, cardiogenic shock, cardiac tamponade, complication of ST elevation, myocardial infraction. Differential diagnosis of mitral regurgitation and ventricular septal rupture. Patient undergoing high-risk cardiac surgery. Acute respiratory distress syndrome. Premature separation of the placenta. Gram-negative sepsis. PA catheterization is also used to guide treatment decisions by allowing providers to deliver targeted therapies, such as medications or mechanical support, with greater accuracy. It helps to monitor hemodynamics of critically ill patients and the effectiveness of ongoing treatments, e.g., measuring CO and assessing effectiveness of heart failure treatment. Contraindications. PA catheterization should be avoided for patients who have the diagnosis of endocarditis. Catheter may displace infection into the pulmonary artery. Tumors or masses, tissues may be displaced. Severe coagulopathy, RIC for blood clot formation. Thrombocytopenia, left bundle, branch block, catheter passage may cause complete heart block. Tricuspid valve regurgitation, difficulty in advancing the catheter. Wolff-Parkinson-White syndrome and Ebstein's malformation. Parts of the PA catheter are PA catheter distal lumen, PA catheter tip, the thermal filament connector, the thermistor connector, the thermistor bead, the optical module connector, the VIP lumen hub, the VIP port, the CVP injectable lumen hub that terminates at the CVP proximal port, the balloon inflation hub, the balloon inflation lock, the 10 and 50 centimeter markings. Parts of the pulmonary artery oximetry, SVO2, catheter model, the PA catheter distal lumen, yellow, terminates at the distal tip, also called PA catheter distal port. This port sits in the pulmonary artery at 0 centimeters and must be transduced with normal saline only. No infusion is allowed. The yellow distal lumen is used to draw the blood sample collected to run SVO2. The thermal filament produces thermal energy employed by the computer for continuous calculation of cardiac output, CO, using thermodilution principle. The thermal filament connector, white with blue top, allows the connection of the computer to the thermal filament. The thermistor connector is a white connector port attached to a temperature-sensitive wire. The proximal portion of the wire is called thermistor bead. The thermistor bead is located 4 centimeters from the PA catheter tip. It lies in a main pulmonary artery. Connecting the thermistor port to the cardiac output, CO monitor, allows determination of a CO using thermodilution. Fiber optical connector or optical module connector, blue flat connector with marking top. Also called SVO2 connector, this component connects to the transmitting and receiving fiber optics that terminate at the tip of the PA catheter. These fibers convey light to the pulmonary artery for measurement of mixed venous oxygen saturation. The amount of light absorbed, refracted, and reflected depends on the relative amounts of oxygenated and deoxygenated hemoglobin in the blood, a process called fiber optic reflectance spectrophotometry. The VIP lumen hub, white, is the lumen for infusion, pressure monitoring, or blood collection. The VIP port, located 30 centimeters from the PA catheter distal lumen, is where fluid given via the VIP lumen hub exit. CVP proximal port, also called proximal injectable lumen hub, blue. This lumen terminates at the proximal injectate port, positioned 26 centimeters from the distal tip. It sits in the right atrium, or the vena cava, allowing for bolus cardiac output, injections monitoring, right, atrial pressure monitoring, blood sampling, or infusion of solutions. Do not infuse continuous drips, such as vasoactive drips, insulin or heparin in this blue lumen. The proximal CVP port will be used to obtain cardiac output readings with 10 milliliters, D5W. The balloon is inflated when advancing the PA catheter from the right atrium to the pulmonary artery and when wedging. The balloon inflation hub, used to inflate or deflate the balloon. This site comes with a 3 milliliter syringe attached. The balloon inflation lock. This lock is made of 2 red lines. When aligned, the catheter is open and the balloon can be inflated or deflated. Markings. The position of the Swan Ganz can be assessed by looking at the markings. Small and large markings are respectively 10 centimeters and 50 centimeters. The total length of the catheter is 100 centimeters. Nursing role in PA catheter insertion. Ensuring patient comfort. Obtaining consent. Flushing to avoid air emboli and zeroing the transducer. Connecting catheter to the flow track. Performing in vitro calibration. Monitor vital signs and any signs of dysrhythmia. During insertion, observe the waveforms as the catheter float through the different chambers of the heart. Performing in vivo calibration. PA catheter waveforms. Let's talk about right atrial pressure, or CVP. This is the waveforms we are expected to see when the catheter is in the right atrium. The pressure is 2 to 6 millimeters of mercury with a mean of 4 millimeters of mercury. Each letter A, C, V, X, or Y represents a specific time of the cardiac cycle. A occurs during atrial contraction at the end diastole and 60 seconds after the P wave. C, tricuspid valve closure. V, atrial filling occurs in late systole. X prime, atrial relaxation occurs in mid-systole. Y occurs early in ventricular diastole. Right ventricle waveform. The right ventricle waveform, abbreviated RV, is a tall wave with no dichrotic notch. RV systolic pressure. Value is 15 to 25 millimeters of mercury, when RV diastolic pressure value is 0 to 8 millimeters of mercury. The pulmonary artery pressure, or PA pressure. The PA pressure wave is a tall wave with a dichrotic notch. Presence of the dichrotic notch indicates closure of the pulmonic valve. PA pressure is composed of the PA systolic, PA diastolic, and PA mean pressures. PA systolic pressure is 15 to 25 millimeters of mercury. PA diastolic pressure is 8 to 15 millimeters of mercury. And the PA mean is 10 to 20 millimeters of mercury. Pulmonary artery wedge pressure, or PAWP, is a measure of the pressure in the artery when the balloon is inflated and wedged. It's also an indirect measurement of the left atrial pressure. Pulmonary artery wedge pressure value is 6 to 12 millimeters of mercury. This is all the waveforms observed when floating the catheter from the right atrium to the pulmonary artery and when wedging. Nursing role in PA catheter. Post-insertion care, obtaining a chest X-ray to monitor the position of the catheter and to rule out pneumothorax. Monitoring vital signs, assessing for complications such as air emboli, thromboembolism, and pulmonary artery infarct. Ensuring proper catheter placement and function by assessing for migration of the catheter. Taking preventive measures to prevent catheter infection. Dressing change and cleaning of the insertion site should be done based on your clinical or hospital protocol.